I'm very interested in this idea of what it is that we do to our cancer patients far above and beyond just getting chemo, getting radiation, or getting surgery. And a big part of that is the way that we impact patients' lives outside of the hospital. Are they able to work? Can they, pay their rent? Are they able to pay all their utilities that they need to keep the lights on in the house and keep their house warm? As a field, we are increasingly understanding that our cancer treatments impact patients and that we need to both measure not only the direct sort of costs of care, like out of pocket costs, but also some of the emotional impact or how patients actually get worried or upset or stressed about the additional burdens that they're worried about. There's actually a number of different ways to actually ask patients about that other side of it, the worry, the stress, the burden that they're feeling. Here at Northwestern, the sort of main measure that we typically use is the cost measure, and that's the most widely used measure across the country. But we actually don't have a really good way of recommending for providers or patients, excuse me, providers or our support staff to actually screen patients ahead of time. So as you're walking into a clinic, is there some sort of questionnaire, whether it's a cost measure or something else, that you can provide to patients upfront and then figure out who is at high risk for having financial toxicity or dealing with this type of stress? And then if you could actually figure out who those patients are, you can better direct them to resources. You can provide them with a financial navigator. You can connect them with your social worker. You can even just provide resources like, hey, we have the Gilda's Club here in Chicago. But if we're not able to screen and figure out who those patients are that are at high risk, we can't actually connect them with any resources at all. And to be quite frank, most hospital systems don't have the bandwidth to do that type of work for every single patient that walks in the door. So, this idea of really figuring out who's at risk, how can we screen patients, is what made me want to go and look at this idea. And I was able to work with some wonderful collaborators at Johns Hopkins University, in particular, Dr. Mahdi, who's a head and neck surgeon there. And we were able to go through and perform this systematic review along with our lead author, who's Nadia Samaha, who did a wonderful job leading this project. And we were able to first ask the question of what screening measures are out there? What are people actually using? And then when we figured out there's actually not very good data on that, we actually extended that to look at more broadly what are the instruments that are out there for financial toxicity, how have they been used, and what have studies shown. So that was the whole kind of idea behind the project and what we did. The biggest takeaway from this systematic review is just how much variability there is out there. So we looked at all the published studies. There were over 1,000 studies that we ended up looking at. Only 51 met all of our inclusion criteria. And we looked at everything that it showed, timing, the setting, what were the tools used, what types of results they found. And there was just so much heterogeneity in terms of what instruments were picked, when they were using them, were there repeated measures, just measure once or measure multiple times, when in somebody's cancer course was it actually used? And there was absolutely no consensus that could be drawn based on the published literature, which really to me just highlights that we just need to do additional work in this space, both in terms of identifying measures that can appropriately screen patients, and then getting some more consensus on all of those questions. When in somebody's treatment course, should we be looking at this? What patients, what populations should be getting screened? What are the tools we should be use? How do we interpret results? So that to me was really the key point. It's just how much heterogeneity was out there and how many different instruments there were. When I think about sort of key points, other points other than the heterogeneity that I really like, and I'm trying to scroll actually to find it, I really like figure 4. So Nadia, again, the lead author on this, made this really beautiful sort of seesaw figure to show what are some of the factors that are protective meaning that patients are less likely to experience financial toxicity. And what are the factors that are risk factors that make someone more at risk to experience financial toxicity? And so it takes all those 51 studies that we looked at, identifies all these different risk factors, and puts them into one nice big figure and splits out those risk factors into socio-demographic. That's things like where you live, or your age, or your race, things that are inherent to you, or things that are clinical. So things about your cancer type, what type of chemo you're receiving. I really love that figure because it really shows how many different things impact financial toxicity. It's not like you can look at someone and just say, oh, you're this age, so therefore you're at risk. But no, there's a million different things that are actually impacting patients. It's, the type of treatment that they're receiving, is if they needed a feeding tube in the past, is, if they're, have higher out of pocket. There's all these different factors. And to me, it really just highlights how incredibly thorny the problem of financial toxicity is, because we think about each of those different risk factors going in and affecting a patient. That's a lot of work for us to do and for us to work on and figure out how we can actually help these patients. Those are two big things that stood out to me from this publication: the heterogeneity in the results and how we weren't able to draw any conclusions about anything. And then separately, how visually you can just really see the way that patients are impacted and what puts them at risk for financial toxicity.